So, oh, there
Hi
she is.
there.
Hi.
How are
Welcome.
you?
It's so great to see you. Thank you
Ni-
so much for joining Healthy Women's IG Live. We're so excited to have you on today's show.
Well, I'm excited to be here. I'm really excited to talk to you about things that matter to women. So, very
So
excited.
important. So before we dive into brain health, can you tell me a little bit about yourself and your practice?
Well, I am a New Yorker since 1986. I love the city. And I've been particularly interested in women's health because I used to run, I was a clinical co-director of the Alzheimer's Disease Research Center at Columbia University. And I once, years and years ago in 1999, saw a patient who had all the signs and symptoms of Alzheimer's disease. And we diagnosed her with Alzheimer's. And then it turned out that it was all related to hormones. And after that, I began my lifelong passion taking care of women with memory disorders and cognitive changes related to menopause and aging in women, which can present very differently than it does in men.
Okay, so I think we're going to go I think we're going to need a whole series
Yeah,
to cover all this because you're reading the mind of not only me but so many of the Healthy Women audience, right?
yeah.
So can we kick off our conversation about menopause and our brain? Like what? So the woman that you diagnosed, and I think for so many of us as
Right.
we're getting older, as we forget, like just simple things like forgetting words or, putting things and not remembering where they are. And we automatically go, oh my goodness, I'm wondering if I'm getting Alzheimer's. Can you walk us through what's normal and what's not?
Well, the most important thing to remember is that forgetting is normal. That forgetting is as important to our brains as remembering is. And that if we did not forget, we wouldn't have figured out how to walk because we would always be crawling. And if we didn't forget, we would not have other children because the pain of childbirth would be still with us. Who wants to go through that again, right? So, but forgetting is very important in allowing our brain to prune itself and shape itself into different forms. As we get older, and especially for women who are part of a sandwich generation, they're taking care of their kids, sometimes spouses and partners, and they're also taking care of their parents. The needs on the attention of the woman becomes inordinate. So they have to remember lists from day to day. They have to take care of their parents, and they have to take care of their children, and they also, very, very importantly, have to be able to function at home and possibly in the workplace. So some of the things that women experience as they're going through the menopausal transition from their mid 40s into their 50s, most women go through menopause at 51, is that they begin to have trouble finding words. So you say carpoo the champet instead of shampooing the carpet. You'll say, well, what's that thing? What's that thing? And then you have trouble. You sometimes mix up, I often do, my dog with my daughter. They have similar names. Lala is my daughter's nickname and Lola is my dog's name. And sometimes I mix them up and I think, my God, what am I doing? And other things that'll happen is it'll be much harder for me to multitask, to keep multiple items in my brain. And all of that is very normal as we go through the menopausal transition. It's only when it affects our ability to function that it becomes a problem. And then you may want to seek help. Some of the biggest problems that I see with women is women are very, very, very good caregivers, but they're horrible at taking care of themselves. So they don't schedule any time. If they schedule downtime for themselves, that's horrible. That's like time for us to feel guilty because how selfish can we be that we would schedule any time to take care of ourselves, right? So there's that problem. So sleeping also, women are often sleep deprived. Not only because sleep is kind of number 500 on our priority of things to do in a day, but also because women going through menopause have hot flashes and night sweats. And it's very hard to sleep through a night when you're completely wet in bed with your blankets all drenched in sweat. So there's that reason. And then there's the stress, going through and handling all these different items. There's a lot of stress involved with that. And sometimes going through menopause, you have mood changes as well. So there's a whole bunch of different factors that all collude to create an environment where you think, oh my God, I'm losing my head. I think I'm having Alzheimer's disease or some other horrible neurologic condition.
Yes. Honestly, this could be like, I'm going to ask you some personal questions too and pretend that they're from our audience.
Yeah.
But anyway, your finger is on the hot button with everything that you're discussing right now, and we're seeing that in the articles that we're writing and the responses that we're getting, the questions that we get online all the time from our audience. It's the menopause, it's the forgetfulness, and certainly we know women are not putting the prioritizing our health. So messaging is right on target. What about family history? And how does that play into Alzheimer's? So if we have a parent or, an aunt or uncle, can you provide some background on what to expect?
Right. So, speaking as the daughter of a mother who had a chronic neurologic illness that had a very common occurrence, she would fall or trip, right? So all of us will trip and fall on occasion. So every time I trip or every time I begin to fall, I think, oh my God, am I getting the same condition that my mom has? Forgetting is the same thing. So we all forget every single day. So if we have a parent or a family member who's forgetting and they had Alzheimer's disease, then when we start forgetting, we think, oh my God, it becomes this very ominous thing. But the truth is, most trips and most forgetting is normal. So it's only when the forgetting begins to affect your functioning that you need help. I just published in the Journal of the American College of Obstetrics and Gynecology 2 patients who were both diagnosed with frontotemporal dementia or with Alzheimer's disease by very respectable centers, who both turned out to have menopause-related cognitive loss. Now, what that tells you is sometimes when you have, and I coined that term, menopause-related cognitive loss, is that it can look exactly like Alzheimer's and it can be very scary. So the family history is helpful, but it is not your genetics, is not your destiny. And most women who have a family member with Alzheimer's, if they can be proactive and get themselves a baseline cognitive evaluation, which I do. For example, I go for a neurologic evaluation every year to make sure that if there's a problem, I can attack it proactively instead of going at it after the fact. Then you can kind of support yourself. And most of the time, most cases of Alzheimer's are not inherited. The vast majority of cases are de novo. They don't occur from genetics. So 60 to 70% of Alzheimer's cases are preventable through good exercise, through a healthy diet, and actually through sleeping well.
Okay, but what if you can't sleep well? So that's, I think that's the $1 million question, especially women that are going through menopause. And I know ever since I've had kids, I don't get that solid sleep that I used to. And many that are the same. They're just, we're not getting that quality sleep. And I think that's and most women don't. So I'm just wondering if that puts us at a higher risk.
Right. So, I have to tell you that every time a study comes out linking sleep to Alzheimer's disease, so many people lose sleep over it. And they think, oh my God. And then they get stressed. They think, oh my God, I'm not sleeping. And because I'm not sleeping, does that put me at risk? And then that makes them more worried and they can't sleep. Mm-hmm. So I think to prioritize sleep, you just have to kind of, once again, say no to multiple things. You're not going to go to that great party because you have to really get your night's sleep. You got to turn off your cell phone, which is very hard for people to do. Leave your television in the other room. If you are going to insist on using your cell phone, use a blue light filter that automatically turns on at 6 or 7 at night and then turns off in the morning, because what that does is it prevents those kinds of pixels that will cause your brain to stay active and melatonin production to vary, because that's what tells you to go to sleep. And then really consider, hot flashes and night sweats are an indication for being on hormones. So you may want to speak to your gynecologist or your obstetrician, or your internist about the possibility of going on hormones when you're having these symptoms, just in the short term, to help you go to sleep. because it's hard to sleep when you're drowning in your own sweat.
Correct.
Yeah.
Correct. Now, what about over-the-counter products? Because I'm telling you, when I'm up at 3 a.m., guess what I'm seeing on infomercials is all these products that are now over-the-counter that are meant to improve or clear, your brain and your thinking. What are your thoughts on over-the-counter products?
Well, I tell you, I mean, it's a great way for many. It's people sometimes take comfort in doing something. If it helps reduce your stress level, great. If you think, oh my God, this particular, I had a patient that I saw yesterday who has Alzheimer's, and she decided she was going to stop taking the medications I prescribed her. She put herself on lion's mane, and she said she's taking it, and it's changed her life. Well, I told her, I said, listen, I'm glad that it's helping you, but I really think you should be on these other medications. And she agreed. As long as it's a medicine that's not going to harm you, it's fine. But really, I think that the single best things, if there were 3 things that I had to choose to help memory in women, it would be consider hormones, make sure you have a diet that is low on refined sugars and carbs. Low on, and that doesn't mean you should go out and have, a high fat diet. That's not what I'm saying. I'm just saying a diet that's low in refined carbs, which means less sugar, etc., because that'll reduce insulin resistance in the brain, which is important to keep the brain and the body very insulin sensitive. And the third thing is, as much as possible, do all the things you can to help you sleep through the night, because when you sleep at night, your brain rehearses different kinds of memory. Sleep is when all the sludge, the plaque deposits in the brain get wheelbarrowed out by the brain's lymphatic system. So sleep is actually preserved across, birds do it, bees do it, and we do it too. We all sleep. And the reason we all sleep is because it's very, very important for our functioning. So if you can say to yourself, my sleep is as important as my being able to take care of my kids and my job, and you really think about it in that way, because it's important for brain health, then that's a good way to approach a healthier brain down the road.
That's great. I love your advice. I love the 3s because I like odd numbers, and the whole idea of genetic does not rule your destiny is so important for all of us to remember. I'm going to give you a couple more questions because I know we have a hard stop today at 12. And we are definitely going to get you back on, because this is you're answering so many great people's questions. I mean, the questions that we're getting, and I thank you for that. So what are some of the brain boosting habits to take up after 40? So if you said to me, like right now, you talked a little bit about exercise, which is so important, eating well. Is there any other things that we can do that'll help boost our brain habits, or that would be good for brain?
So I always say diversify your cognitive portfolio. So if you're somebody who's a writer, go out and take up running. If you're somebody who's a carpenter, go in and do something differently, like take up book editing or something. So try to use different sides of your brain, and that's a good way to think about and conceptualize what you need to do. Optimize your diet. And I once again want to say, in terms of destiny, you can have a pair of identical twins, one of whom has Alzheimer's and the other doesn't, for as long as 17 years. So just remember that you can modify your risk and make your brain much more healthy down the road by doing simple things now.
Dr. Devi, thank you so much for your time today. We look forward to having you back on the program.
Thanks, Beth. It was a delight to be with you today.
Take care. Bye-bye.